When was your mini gastric bypass done?
7th.
7th. Today is 11th.
Yeah.
This is day 4.
This is day 4.
And so after day 1, did you try some semi-solids?
I tried biscuits on the second day.
Some curd or
yes.
some dal thing?
Yes.
Okay.
I've been taking dal and khichdi and all.
Okay. You won't be able to take this much in one go.
Yeah.
Just
not
take
at,
spoon by spoon. Go slow.
Little.
Yeah, but it will go down easily. Did we do her barium yesterday? Can I have a look? You must try to register this in your mind, what you see in the screen, so that you know what you have inside, and that will keep guiding you throughout your life, because you must know what the system is like now. Whatever you are eating is coming here. This is the food pipe. And now here it's entering the stomach, which again looks like a tube.
Correct.
So your stomach is no more a bag.
Yeah.
It's a smart tube. This is number 1. Because earlier the stomach was like a bag. And now it's a tube, it will take less time to fill up.
Correct.
And then this tube is leading to the intestine. Can you see this?
Yes.
Going down here?
Yes.
This is the joint, the bypass. The food is going down into the intestine. And intestine has never learned to be a reservoir.
Yeah. That's true.
You cannot dump food into
the
it
intestine
recklessly. You cannot keep eating, So after having a moderate amount of diet, intestine is having thin wall, like the tube of a bicycle.
Correct.
So it will dilate when you eat something. And when it dilates, your brain will get a signal that
no more.
It needs no more. So this is the main difference. You will feel that I am done. And this procedure is not stopping you suddenly, unlike the old bands or the tight outlet pouches of Ru and Y, where the outlet was 1.5 centimeters. Here the outlet is 5 centimeters. So because we believe that the diameter of the food pipe and then the diameter of the stomach tube should be either equal, or the stomach tube should be a little bit bigger than the food pipe. That's number 1, because we don't want your food to stop on the way.
Correct.
And that is what makes you have 0 nausea. What about nausea, feeling of nausea?
No, nothing at all.
10 out of 10, is it 1 or 0 or 5?
0.
So because there's no reason to have nausea. Because it's not stopping on the way. Simple Bernoulli's theorem, which they teach to 9th standard students in school, physics. Because if you don't obstruct a tube, the pressure will not increase inside. And if the pressure is not increasing,
then you don't have any.
You will not have reflux.
Correct.
But the trick is, the food is going down into the intestine. Intestine is like a tube here. So the food is getting into this tube without any sudden tightness. The door is 5 centimeters. Food can get down. But this tube will start dilating. This tube has never learned to be a reservoir. So you can eat into the tube, but you cannot eat, too much.
Yes.
After eating a moderate amount, and what is that moderate amount? It's different for every patient. Depends on the behavior of your intestine.
Correct.
You will see some of our patients can take chapati, half chapati. We ask them to try this after 7 days. Because in 7 days, the joint which we have constructed here, the anastomosis, has healed up properly. And that is the time when we can put some stress on it. And before that, you should be taking semi-solids. So on day 7, when you try chapati, you can try chicken, you can try anything, any fruits, any solid fruits or whatever you want. Chew well, go slow. It's like a narrow road, but the traffic is moving. It's not a traffic jam.
It's not like before, so.
Yes. So, but again, your food will enter into the tube, which can accommodate a little bit. It's compliant. It's flexible.
Correct.
So it will dilate, but cannot dilate too much. So once it reaches a level, and then it sends signals to your brain, and we call it functional restriction, as compared to the mechanical obstruction of the old restrictive techniques. And this functional restriction, because the opening is wide, and even after 10 years of surgery, most of the patients will be eating like the same,
Same.
because it's not dilating too much.
Huh.
So in the beginning, it's giving you zero nausea,
Correct.
less chances of leak, because there's no pressure.
No pressure.
And then in the long run, it's not dilating even, because there's no pressure.
Pressure.
Because dilation will need some pressure.
Correct.
So that is what makes it different from sleeve
Sleeves.
gastrectomy,